Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about the news and trends impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Ernie Shopes, the president and general manager of our pharmacy business unit. This episode is part of a mini-series where we look specifically at 2025 and what our internal thought leaders predict will be top of mind in the healthcare technology space. Today, Ernie and I are going to discuss the specialty pharmacy arena specifically. Thanks for being here today, Ernie.
Thanks, Justine. Glad to be here.
Before we get into the possibilities of the new year, let's just take a minute to reflect. Can you tell me how the specialty pharmacy space has grown and evolved in recent years?
Sure, Justine. There's been a number of changes over the recent years. Introduction of gene and cell therapy, a lot of new discussions, questions, how to treat, how to pay, what the responsibilities are of each of the stakeholders. Biosimilars, relatively new. They've been around, but taking more impact to the pharmacies and how they manage those. And probably most prominent is the shortage of healthcare workers and what that means to the pharmacists and pharmacies coming out of the pandemic and what their stakeholders are expecting.
So a lot of evolution, but a little bit of strain there, it sounds like. So what does this mean for the behind the scenes of pharmacy operations and patient management?
Sure. Yeah, I mean, these pharmacies and pharmacists need flexibility, scalability. They need to do more with less without sacrificing the quality of care, which is difficult at best. So they're trying to find ways to do that. The stakeholder demands still remain high. They are in the specialty space, one of the best healthcare worker environments to engage with these patients because they interact with them typically every 30 days at least, which unlike other healthcare workers, whether it's the prescriber or someone on the payer side, they're just not engaged as frequently. So they are good stewards of that patient and making sure that they stay on care, intervene when appropriately, and they're being asked to do more, and they are the right group to do it. They just need the right tools to be able to do so.
Okay, so that leads me nicely into the next question here is looking at that point of care and quality of care. How can data and technology better support pharmacists in the day-to-day routine and improving that level of care?
For sure. Yeah, I mean, there's a lot of things that happen in today's world in healthcare, a lot of faxing, a lot of manual tasks, a lot of phone calls, a lot of chasing of data and information that simply has to get automated. It's got to get automated, scalable, but it also has to be accurate. So one of the products we have in DataStream, it fits really nicely into this ecosystem in terms of prescriptions are received by a pharmacy with little information, whether that's little clinical information, little financial information, and that pharmacy needs to gather that information to be able to treat the patient, understand clinically what's appropriate or inappropriate, what coverage they may have. And in today's world, a lot of that is done via phone and fax back to the prescribers, who they also have shortages in staff and don't want to have to answer phones or respond to faxes, outreaches to patients or caregivers that may not have the whole story. They may either not know about a parent and what medications or have forgotten what medications they've taken. So in an automated way, when we can use the data that we have to go obtain that data and put that in front of the pharmacist in near real time at the point of care, it really optimizes the efficiency, the speed to therapy, and the overall quality of care for that patient, also while minimizing the abrasion to that prescriber's office, as well as the patient. The engagement is completely different. In speaking with a patient, when you're informed and reviewing things versus asking for information, just changes the complexion of the engagement. And these patients in the specialty space, typically when they're starting therapy, they're in a state of shock. These are chronic illnesses. They're very complex. They don't know how to navigate this, so working with an informed clinician is a large step ahead.
All right, so a lot of opportunity here for technology and data to have a positive impact on this space. Tell me, what is your number one prediction looking forward to 2025 for specialty pharmacy?
Yeah, for specialty pharmacy, I think the prediction is the pharmacies and pharmacists and organizations that really embrace technology in the right way to scale and have the flexibility they need will win. Like we said, there's a shortage of these healthcare workers. They need to do more with less. They have the opportunity. They're looking for incremental revenue streams to support their business. They need the technology that supports it in the right way. And sometimes that's a hard thing to change. Clinicians want to have the details. They want to do things by themselves and engage in the right way. And sometimes automation is a little scary, right? For folks entrusting an application or trusting a system to do things. And I'm not suggesting that we get rid of clinical decisions from clinicians, but the supporting information, supporting data, supporting processes are critical to the scalability of healthcare and specifically our specialty pharmacies. The demands of stakeholders are high, whether that's a life sciences or pharma organization, payer, patients, prescribers, and these pharmacies and pharmacists need the right tool set to automate those mundane tasks and minimize low-value activities for sure.
So kind of a follow-up question to that. We know that AI has been a big conversation in the healthcare space. Do you think that there is opportunity for AI to positively impact the space as well?
Yes, absolutely. There is definitely a place for AI. We know it's not going away. It's here to stay. I think it's a matter of understanding where it fits. And some may have fears around clinical aspects and use of AI. So we need to be very mindful of where it gets put into the process, how we validate the quality of the output, and making sure that we're not going too far, right? It's still relatively new, not in terms of availability. It's been around for many, many years, but where does it best fit in a clinical operation, in a specialty pharmacy? How can we best take advantage of it and grow into it as it continues to improve year after year? So we got to make sure that we don't force it for those that are fearful of it, but it has to have its place if we really want to grow and automate and get to the next level.
Absolutely. Very exciting stuff, Ernie. Will certainly be interesting to see what is to come in 2025, but really appreciate you taking the time to share this insight with us.
Thanks, Justine. Glad to be here.
And thank you, of course, to our audience for tuning in. Be sure to check out the other episodes of our Trends and Predictions miniseries on our website.